Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi R. She is a renowned gynecologist, obstetrician at Udupi. More than that, she is a past president of IMA and now the present president of
OBG
OBGC,
Society,
OBGC
Manipal.
Society of, and then she is also a writer who has been writing columns, a prolific writer, and she has written a book, Vatsalya Osage, for the people, the women to understand A to Z all the problems that a woman can go through in her lifetime. So let us welcome her. Welcome, Dr. Rajlakshmi.
Thank you, ma'am. Thank you for the opportunity and such kind introduction.
Yeah.
It's always pleasure to
Always,
speak to you.
yeah, it's my pleasure. Always there was a time, they used to fetoscopy, they used to spend the whole night looking for the fetal heart sounds and all that, and then they used to have problem. The moment the ultrasound came, all the gynecologists it was like a boon to them. So they were elated. But then what happened was, I remember I was also a person who went again for the protest against the female feticide near Malvalli, Mandya, and that time all the nursing homes with the ultrascan were closed. And then the PCPNDT Act came. What is that?
Okay, yes, ma'am. See, science is always has a two sides. Like if you are given a knife, you can use it to cut a vegetable also, you can use it to cut a person also. So, same way, ultrasound was also being misused. It was made to diagnose the fetal anomalies, fetal well-being and all, but it was being misused to detect the sex of the baby. So to prevent that, because of this detection and female feticide, the sexual ratio came down. The ratio between the male and female fetuses came down. So to prevent that, government got this act called PCPNDT. It is preconception, prenatal detection, diagnostic technology for the pregnant lady. So according to this act, we are not supposed to detect or disclose the sex of the baby, the one who is doing the scan. The person who is seeking the scan is not supposed to ask for the sex of the baby. So before they enter into that scanning room, we make them sign a form. It's called Form F, which states that the doctor also will not disclose, and I also don't want to know the sex of the baby. They have to sign. And in the room also, we are not to keep any photos. We are not to keep anything suggestive of male or female. And usually we don't allow any attender also. No mobile phones. Nothing can be recorded. So with such stringent law, the Linganupada sex ratio has come down a little bit. It's almost become almost. It's coming
Equal.
near.
Now
Okay.
almost equal.
Equals.
Mm.
Yeah.
Yeah.
No, but still it is some 950 ladies,
I know,
female
I
for
know, I
1,000
know.
males, but still better than that 700 and all. It has come up very well.
Yeah, yeah, correct, correct. Now, since we know that this ultrasound is a very, very good tool, please tell us from what time of the pregnancy you start and how many times you do, and what is the importance of repeatedly doing this ultrasound scanning.
So, yes, surely, ma'am. See, ultrasound is, as you said, is a boon for us. We use ultrasound probe more than our stethoscopes, especially the
Correct,
obstetrician. There are
correct.
two kinds of ultrasound. There is one abdominal, transabdominal and transvaginal scan. In the first 3 months or the 12 weeks of pregnancy, we would like to do a vaginal scan, transvaginal scan. That is because you can observe the fetus from the very close proximity, and the because of the magnification also we can make out very well if the baby is growing well, if there are any abnormalities, any anomalies can be made out. After 12 weeks of the gestation, the uterus starts growing up, it starts coming up, and then we start doing the abdominal scan.
Correct.
Sometimes people, if they are not very comfortable with the vaginal scan, we do trans-abdominal scan within the first trimester also. But during that time, we need to have the bladder. Urinary bladder should be full. Otherwise, we
Full.
won't be able to see what is there
Uterus
in the
cannot be lifted
uterus.
up to get the seat. Okay.
Yes.
Mm.
So this is the two types. Now, when all we do? First, we do around 6 weeks. Just to do, we call it as a dating scan to say whether the baby is, she's pregnant, whether the fetus is inside or outside, whether it is ectopic pregnancy, how many fetuses are there, is there only one or two, and then exactly say the dating, how, what is the gestational age of the fetus. This is what we do in this 6 week scan. Then we have a scan around 11 weeks to 13 weeks. That is when we say in colloquial terms, it's about 3 months. That is called as NT-NB scan. We see the nuchal thickness, the thickness behind the neck of the fetus and the nasal bone development. This is to, the interpretation is for to rule out Down syndrome, Turner syndrome, any chromosome anomalies, or any, even we use this time, we scan for basic, early anomaly scan we do.
Of the
We can see the
neurological
yeah,
problems
neural
like
tube defects
hydrocephalus
or
or
major
spina bifida
cardiac
and all the
defects. Yeah,
cardiac.
major cardiac defects that can be seen. And nowadays, we also assess the blood flow along the blood vessels to see, to predict whether this pregnant lady will develop hypertension during pregnancy. So these things happen during 11 to 14 weeks. Next, we have a scan around 20 to 22 weeks. We call it as TIFA, targeted imaging of fetal anatomy. All the parts of the baby, the heart, the lung, the brain, kidneys, everything, genitals, all will be seen in this. And if it is done to detect any anomalies. Routinely, it was called as anomaly scan. Now we have made it as targeted imaging of the skin.
Correct.
So this is done around 20 to 22 weeks. And around 22 weeks or 24 weeks, we also conduct a fetal echo. That is the
Correct.
echocardiogram of
To
the
see the heart
baby.
of the baby. Yes.
Heart of the baby. Okay,
Yes.
it will tell you whether heart is beating properly, functioning properly, whether there are any defects in the heart. That will be told.
Yeah, it can
Then
tell the
around
heart
20,
rate as well as the arrhythmias. If the baby has
yes,
got
fetal
any
arrhythmias.
arrhythmia, the fast rate or the bradycardia, slow rate, all can be made out. And also, if there is an anomaly like a AV canal defect, which 50% of them will have the Down syndrome. So that time we can advise the gynecologist and also the consult the what you say like genetician to do the counseling for the patient, because
Yes,
even
whether
if
to,
we do the surgery and make the heart normal, brain will not be normal. So the parents have
yes,
to take the decision whether to
this
terminate the pregnancy or not. So all
order
that, it's like a teamwork, and then we all work for the benefit of the
together.
patient, yeah, pregnant lady, and to have a normal baby for her. Yes.
Yes. Then, as she enters the third trimester, around 30 to 32 weeks, we do a growth scan to see how the
Hmm.
baby is growing. Right,
Hmm.
to calculate the weight, we take some measurement, the head, the abdominal circumference, the femur
Hmm.
length, and we assess the weight. This abdominal circumference, we also use it to do this detect whether the baby is lagging behind in growth. Fetal growth
Hmm.
restriction, the first thing which is going to come down is the abdominal circumference.
Good.
So we do measure that also. And then fetal weight, as I told, where is the placenta? Is it touching down in the cervix or is it come up?
Placenta
What is the amount
previa
of
or
light?
it. Yes, yes.
Yeah, what is the amount of amniotic fluid inside? All these things we do check. Then
Correct.
there is another special scan called as Doppler, antenatal Doppler we call. In this scan, we assess the blood flow in the uterine vessels, the umbilical vessels, and the blood vessels of the baby's cranium. Baby's brain
Yes,
also we assess.
yes.
So this is to say whether the baby is going for any growth restriction. We do these Doppler scans sometimes to time the delivery, because if we
Okay.
take out baby too early, baby will be compromised.
Premature.
If we
Yes.
delay also, baby will be
It
compromised.
will
So
over
to time
mature.
the
Yes.
delivery, we
Hmm.
use this Doppler scans.
Okay.
And nowadays, even during delivery, sometimes we do need to see the
Hmm.
some malpositions like bro presentations or some face presentations. If there is the labor is not progressing, so to see till where the baby has reached, the fetus height has reached, or even that scans are done during the labor also.
Hmm.
So
Hmm.
throughout the pregnancy, we are using this ultrasound scans.
Yeah, when
And
you mentioned about the placenta, I remember before the ultrasound came, this placenta previa patients used to come with the bleeding. And many a times the
Yes.
obstetricians used to lose the patient because immediately blood never used to be available then. Now the things are so better and you can prevent such tragedies. And then you said the
Yes.
face presentation. When the face presentation, those days they couldn't make out. And that time the child used to be born with the swollen face, because the so much of pressure is
Bluish
there.
face.
Yeah, bluish,
Mm.
and it was it used to take time for the face to become all
Baby
right.
to
Yeah,
circulation to
baby to,
return
yeah,
back.
yeah.
Yeah.
So all those things can be avoided by those complications by this ultrasound during the
Yes.
delivery. Yeah,
Yes.
yeah,
And nowadays we have even fetal interventions.
yes,
Along associate, we can use this ultrasound to do some minor surgeries within the baby, some blood transfusion in case of Rh negative pregnancies, and some cardiac defects can be
yeah.
corrected.
The
I think
cardiac
I
defect,
heard even.
especially, the if there is a aortic stenosis pinpoint, and that
Hmm,
used to be like a hydrops fetalis and 100% mortality. I have
hmm,
done one baby soon after birth, 14 hours after the birth, but that can be done even before the
in
birth, so that,
utero.
yeah. Otherwise,
And
soon after
even
birth, putting ventilator and struggling, and the child may recover or not, and the brain damage may occur. And that's how we know the intrauterine fetal interventions are also there now.
it can be done.
Yeah,
I think even they have started injecting pharmaceutical drugs in case of fetal arrhythmia and all. They have started
arrhythmias,
using
correct,
that.
correct,
Fetal
yes,
ascites, if there is a fetal ascites and all, they have started using shunts also. So there are
correct.
many new interventions coming up.
Interventions have
So
come, yes,
ultrasound is really a good thing to be used in a pregnant lady. But when we advise, people ask, do we need so many scans? Previous days and
correct,
all, we used to
correct.
deliver without scans. But
Mm.
as the science has advanced, our life is also seen so many changes. Our lifestyle has
Yes,
changed, and there are so many
correct,
complications in
correct.
the pregnancy. So,
Yes,
to diagnose that, we need some gadget, and that is the ultrasound. And too many ultrasounds, sometimes we do like more. I told 5 scans in a normal pregnant lady, in a low risk pregnant lady. If she's a high risk, we might need to do more often, and number will be more. But I wish to tell them that, see, when we are doing ultrasound, we know very well that we are taking time, and this ultrasound, what the baby is getting exposed, will not cause any harm to the
any
baby
harm,
or to the
yeah,
mother.
very
It will
safe.
not cause any
It is
adverse
not like the
effects.
x-rays, yeah, correct.
Yeah, it will not cause any adverse effect. It is for their benefit only.
Yeah. In
Yes,
fact,
ma'am.
this reduces the mortality in both mother as well as the
As
baby.
the, yes,
And yeah,
both
and all
maternal and infant
complications can be
mortality.
minimized. Thank you so much,
Yes.
Dr. Raj Lakshmi. You have explained so beautifully. Thank you very much.
Thank you, ma'am. Thank you so much.